Hi, Wolverines. I'm Austin. I'm super excited to be here today with the University of Michigan's Chief Health Officer, Dr. Robert Ernst.
Hey, Austin. It's great to see you.
Thanks for being here today. So right now, we're on the 4th floor of the Union in the CAPS Wellness Zone, complete with massage chairs and yoga mats. What else could you tell us about this space?
Well, this is one of 3 wellness zones across the campus. Besides this one here on the 4th floor of the Union, there's also a North Campus wellness zone in the lower level of the Pierpont Commons, and there's a wellness zone in the Munger building. We encourage all students to just stop by when they're looking for a quiet place to relax.
And this is connected to the CAPS central office right through those doors.
That's right. This whole 4th floor of the Union is becoming kind of a wellness hub. So in addition to CAPS and the wellness zone, the SAFAC offices are right across the hall. And I'm really excited to announce that we've just launched a health and wellness vending machine that's right here in the lobby. That's available to the whole community.
So like vending machine, like chips and candy bars and stuff like that?
Well, it's the same idea, but in this case, it's more health and wellness related products.
So like ibuprofen, chapstick, COVID tests, things like that?
Exactly. We also have some more sensitive and urgent items like naloxone to have on hand in case of a suspected opioid overdose, and emergency contraceptive to prevent pregnancy after unprotected sex.
And I bet it'll be easier for students to get some of this stuff without having to go to a pharmacy or something late at night, especially since the Union is open till 2 a.m.
Well, exactly. We think this model will work here as well as across some of the other campuses. So the Flint and Dearborn campus now each have a machine in their university centers, and we're working on adding additional machines on other locations across the Ann Arbor campus.
So why now? How did these machines come to be?
Well, these came out of input we received directly from student leaders, as well as recommendations that came from a university-wide task force. Our goal always is to make sure students have easy, reliable access to healthcare and products that they need. This is part of what we call being a health-promoting university, and it's something that we take very seriously at UHS.
The health service does a lot of things that are generally geared toward college students, right?
Absolutely. This includes comprehensive STI testing, HIV prevention medications. We have a gender-affirming care clinic. We're able to do evaluation and treatment after a sexual assault, and we offer options counseling after pregnancy that includes even medication-induced abortion.
So hopefully whenever somebody stops to get something from the vending machines, they'll also remember to check out UHS.
Well, exactly.
All right. Well, thank you so much for your time, Dr. Ernst. Really appreciate it. And go Blue.